Hello and welcome guys to my channel, the Success Association of Medical Literature. So I am here with the new video, and today's video is on the assignment which I submitted to the college, is based on Operation Theatre Report, OT report. So let's start with today's video and today's topic. So you have to start with the college name, Operation Theatre Report, remarks submitted to college, the name to whom you are submitting, the post of the teacher, college name, and submitted by and submitted on. So this is the Operation Theatre Report. So I have just made some diagram based on the doctors and nurses doing the operation. So Operation Theatre Report, so it is some type of web, so you can just, wherever you want to check with the details, you can just stop with the video and you can just take the notes and you can just make the report if you want. So I will just take in small, not in the much detail, I will just take a glance of the video. So starting with the introduction of the OT, that is Operation Theatre, is a facility within a hospital where surgical operations are carried out in a septic environment. That is a septic environment, that is absent of or organisms environment, which is done by doing fumigation of the operation theatre. Operation theatre refers to non-sterile tied theatre in which students and other watches surgeons performing surgery and preparation of the operation team of the operation theatre. So you can just stop the video and you can go through the content if you want. So this was Operation Theatre. Then scrubbing and washing, details of the scrubbing and washing of the hands, then the routine investigations, the history of the patient before the patient is taken into the hospital. These are some of the things. And classification of OT, there are various types of operation theatre: major operation theatre, minor operation theatre. That is, this was the major and minor, so this was the minor operation theatre and this is the major operation theatre. Then outpatient OT, then inpatient OT, then centralized OT, decentralized OT, conventional OT, ultra clean or laminar low OT, then emergency OT, then elective OT. These are the various types of OT: major, minor, outpatient, inpatient, centralized, decentralized, elective, emergency, ultra clean, laminar, conventional OT. This is the layout of the hospital OT. So this was a hospital where I was posted for my clinical posting. So there was an entry, the nurses station, nurses room, autoclaving area, dirtying linen, recovery room, linen room, ENT OT was there, surgery major OT was there, and opthal OT was there, in which there was a storeroom and scrub area. Then changing room was there, then the doctor's room was there, and the washroom was there. So this is the layout. After the introduction, you have to, after classification of OT, you can just draw with the layout. Then coming to the operation room team, that is staffing and the role: surgeon, anesthetist, OT technician, OT cleaners, nurses based on the nursing staff in OT, that is chief nursing officer, deputy nursing director, OT supervisor, scrub nurse, and circulatory nurse. In OT, there are two types of nurse: scrub nurse and circulatory nurse. Both have different function. We will see further. Then these are the management of the OT register. These are the register which has to be managed in the OT, which are managed by the nurses in the OT, along with the help of doctors and OT technicians. You can just go through this content. Union register. There are various type of 23 different types of registers were maintained in that hospital where I was posted for my clinical hours. So this was then coming to the protocols of the operation theatre. These are the protocols which are based on the OT techniques, aseptic procedures, aseptic techniques which are followed in the OT operation theatre. And these protocols are based on different types of hospitals, government setup, private hospitals, NABH hospitals. So depending on that, there are protocols like antibiotics, antimicrobial agent, antiseptics, sepsis techniques, then aseptic processing, biological indicators, then disinfection, detergent, linen, operating room, and all that. Then operating care. So there are three types of operating there. This is the three types: pre-operative care, intraoperative, and post-operative care of the patient. So pre-operative care is this intro, and this other details, and this other pre-operative checklist which has to be checked before the patient is entered into the like OT in the ward itself. This has to be checked, pre-operative checklist before the surgery. And steps in pre-operative preparation, role of pre-operative nurse. This is the important for the nurses, pre-operative nurse. can just go through it. Then second is the post-operative care, pre-operative, post-operative, and intraoperative. Pre-operative is done. This is the post-operative. Post-operative type of surgery, health history, site of surgery, monitor and observation. Then wound care, infection prevention. There's a medication instruction, activity restriction, follow-up appointment, respiratory care. Coming to the emotional support, patient education. This is the post-operative checklist. That was pre-operative checklist. This is post-operative checklist, which has to be checked. Vitals, then report, then specimen. Surgical safety checklist. This also comes in post-operative. The anesthesia, surgeons, and the nurses have to fill these forms. Then duties and responsibilities of a nurse in the OT. During pre-operative care, what is the responsibility of the nurse? You can just stop the video and you can go through the details. This is during intraoperative and this is during post-operative phase. What are the duties of the nurse? Scrub nurse and the circulatory nurse. Disinfection and sterilization technique. Medical asepsis, surgical asepsis. This is disinfection and sterilization. Disinfection. Physical, boiling, chemical disinfection. Types of disinfection. High level, intermediate level, low level. Disinfection. Sterilization, methods of sterilization: steam sterilization, heat sterilization, dry heat and moist heat, hot air oven, autoclaving 121 degrees Celsius, gaseous sterilization, filtration, radiation, ionizing, non-ionizing. So the details of this are steam sterilization, dry heat sterilization, then this are the dash. Then environmental cleaning, premises, buildings, air, water, the cleaning of the environment of the OT. Then emergency drugs, which are kept in the OT itself, which is taken care by the doctors, taken care by the nurses. The doctor uses is the anesthesiologist, and the OT uses this drugs. They are different, and these are different. Drug study can be written for this. So just the name, pharmacological name, and the drug name. Emergency drugs. Then types of solution: IV fluids which are kept, isotonic, hypotonic IV fluid, that is normal saline, NaCl, then dextrose, then RL, finger lactate solutions. These are the salines. Then donning and doffing, which is followed, that is OT, head cap, mask, goggles, shoe covers, gown, gloves, the gown, green color gown, which is words. And the donning means wearing of that this things, and doffing means removing this and discarding it. So donning and doffing. Hand cover and how to do this donning PP kit. This is the steps. Firstly, hand hygiene, then put on shoe cover, put on gown, put on mask, put on goggles, put on gloves. This is the donning step by step. And doffing step is remove shoe cover, remove gown and glove, perform hand hygiene, remove goggles, remove mask, perform hand hygiene. Suture material. These are the suture material, like suture yani ki material used for tying, like after the cut, incision is taken after the operation, we have to tie the skin, like स्किन को फिर से टाके डालने होते हैं. तो टाइप्स ऑफ सूचर: एब्जॉर्बेबल, नॉन एब्जॉर्बेबल. दिस आर द डिस्क्रिप्शन ऑफ सूचर. Natural synthetic. You can just stop the video and you can just go through it. General principles which has to be followed in the OT, and like which is related to the suture: absorbable, non-absorbable, natural synthetic. Introduction of suture material. Now absorbable, non-absorbable, we will go in detail. General principles of suturing, then absorbable sutures and non-absorbable sutures. General principles, just go through it once. Absorbable sutures, this. So these are the absorbable sutures. So during operation theater, after the operation, I have just picked up some of the suture material from the OT, like to show you all. This is like absorbable suture material, like this is like Ethelon. Then Ethelon was this is not the suture material, this is the scalpel material, like the blade material. Then this is the suture material Vicryl. This is the Vicryl as a Ethelon. So this was a absorbable. Then this was again absorbable itself. This is again Vicryl. Then non-absorbable, intro and all the non-absorbable one. So now coming to the anesthesia, various types of anesthesia. This is the introduction of anesthesia. Now there are so many of anesthesia. This is anesthesia types of anesthesia: general, regional, sedational, local. General, intravenous, inhaled, intravenous, spinal, epidural, acupuncture. General anesthesia. Intravenous inhalation, the details of that: regional anesthesia, spinal anesthesia. epidural, femoral, then sedational anesthesia. Epidural, sedational anesthesia. Local anesthesia types. Then basic instruments, which are now basic instrument. There are various types of instruments made up of stainless steel are used during operation theater. So just I have just taken like some of the instruments I have explained here. There are so many instruments, you can go through Google or you can check with books for this instrument, but this is some general instrument. This is one of the BP handle, which is most common instrument, like this is used for taking the incision with having different blades. Go to the information, that is BP handle, called as BP handle, taken for the this is the BP handle. On this blades are fitted and the incision is taken. This is called as BP handle. Then this is the towel clip. There are different types of towel clip. These are the different types of from which this are, I've taken two diagrams. And artery forceps, this is plain and this is the curved. So types, then common features and uses. This is the Kocher's hemostatic forceps, mosquito artery forceps, and Kochek's hemostatic forceps. Intro, then uses. This is the retractor. There are various types of retractors. I have taken two types of retractor, plain and self-retaining. Langenbeck's retractor and Doyen's retractor. The features, uses. Dissecting forceps intro, types plain and toothed forceps. This is the plain forceps, this is toothed, there is a tooth over here, helps in the suture with the artery forceps. This curved artery forceps, we can curved artery forceps we have to handle in this hand. In this hand we have to take with this tooth forceps. With tooth forceps we will hold the skin, and with curved artery forceps we will fit the needle, suturing needle, and with that we will just suture the skin. Features and uses. The setting forceps, then scissors are there. Are intro of scissor, there are various types: straight scissor, curved scissor, for used in the OT for cutting the sutures or for any other purposes. Then gauze cutting scissor, stitch cutting scissor. This was I was talking stitch, that is stitches, like after sutures, stitch cutting scissor. Features and uses. Tissue holding forceps, this is Ali's tissue forceps and it is Babcock's tissue forceps. Types: traumatizing, toothed, non-traumatizing, non-toothed. This is intro and these are the types and these are the uses of that forceps. So something around 16 instruments I have taken, basic instruments, as I explained in this video. There are many instruments, you can just go through that as well. Needle holder. So this is needle holder, method of using the needle holder. This is the needle holder. Like I was asking about the artery forceps. With the artery forceps of this needle holder, this is the needle, and this is the suture material. With this help we will hold the needle, and with that tooth forceps we will hold the skin and we will just suture. Features and uses. This is proctoscope. Intro, this is the proctoscope. It is mainly used to examine the anal region of the patient, like for examination of the piles and ulcers of the rectum, or for taking the biopsy, also proctoscope. Then this is the Valsalem. This is a straight and this is the curved. Mainly this is used in obstetrics and gynecology. When you will study for the obstetrics and gynec, you will got to know what is the instrument used for, but this is are the uses. Used for the grip the cervical lips to visualize the cervix, and it is also used for vaginal hysterectomy. Then biomedical waste management. At the end, biomedical waste management, there is more, there is no end for this OT, but at the end you can add biomedical waste management. This is the intro, what is biomedical waste management. This is the definition of it. These are the color codings for disposing the waste. Yellow, mainly in yellow, anatomical waste, human anatomical waste. Patient related infected waste will go into yellow bag. Black bag is for general waste. Red bag is for the plastic waste, like IV tubings, plastic bottles and all. White is for the needles, like sharp needles, scars. This is the main important, and here we will also can include needle stick injury needles, which has to be disposed in white. That is puncture proof bag. Then blue one is for the sharps, like ampules, wires, the injections, like we have to discard in blue. These are the color codings. This is biohazard, symbol of the biohazard, which is there on this dustbins, like over here biomedical. And this is a cytotoxic hazard. This is mainly for the cytotoxic material, for example in chemotherapy drugs and all are thrown into this type of biomedical waste. And there are various type of disposal method. One of it is incineration. Then these are the steps of BMW management, that is segregation, collection, pre-treatment, transportation, storage. And lastly, I have come to end with the summary, evaluation, conclusion. All the things I have just concluded in on one page. And this was a bibliography, like from where I have taken the content, and I have written don't end of OT report. So my coordinator has given don't mention such thing, because OT report will not come to end, and when much more things can be added, like different types of surgeries which are performed in the OT, and different types of more instruments and different types of procedures more can be included under this OT report. So this was the end of my OT report. So thanks for watching.